Good morning. Thank you, Mary, and thank you for having me this morning. As Mary said, I'm Keith Argenbright. I'm at UT Southwestern in Dallas, but you'll see that our reach is much further than one city. And then I also am the director of the Moncrief Cancer Institute as well. And so it's going to be my pleasure today to spend a few minutes talking to you about rural cancer care and reaching rural cancer survivors. It's a passion of mine, and it's a passion of what our entire organization does. And you'll see as we go through here that we have both a rural as well as urban component to our program, but most of the time I'm going to be spending on the rural piece of that. So I thought that what we would do this morning is I would take you briefly through who we are and what it is that we do, talk to you a little bit about the cancer burden in rural America, dive into our program a little bit and talk about some of the successes that we've had. And then I know you spent a lot of time yesterday speaking about challenges. And yes, there are challenges, and I thought that I would go through and talk to you about some of the ones that we've had and hopefully some of the ways that we've overcome some of those challenges. And then talk a little bit about opportunities and where it is that we go next. So as I said before, we are part of UT Southwestern in Dallas. Actually, the Moncrief Cancer Institute is in Fort Worth. And those of you who have flown through the way station between the East Coast and the West Coast, the DFW airport is kind of right in the middle, where Dallas is about 20 miles or so, or 15 miles or so to the east of you at that point. Fort Worth is about 15 miles to the west of you. So there's about a 30-mile difference between the two, but we are all one entity and part of the Simmons Comprehensive Cancer Center. Moncrief, our organization within UT Southwestern, focuses on prevention, early detection, patient navigation, and survivorship services. And most of our patients are either uninsured or underinsured. And so the bullet point that you saw in Mary's slides before, how do we deliver care to this very vulnerable and needy population? That's really one of the things that we focus our efforts on. We will, through all of these programs, the prevention, the early detection survivorship program, we will reach about 20,000 unique individuals this year. Most of those are not survivors. Most of those are routine scheduled mammograms or fecal immunochemical tests or pap smears. So we do a lot of screening. And so the part that I'm going to talk to you about mainly today is a very small subset of that, but a very important subset of that, which is the survivorship. So this is our service area. You can see it is 35 counties in North Texas. Tarrant is where Fort Worth is located. Dallas is where Dallas is located. This little area right here I was talking about is the DFW airport. But you can see this very large, it's about 18,000 square miles, and you're going to hear from a colleague of mine in a few moments from two colleagues of mine from the state of South Carolina. And our geographic area is about the size of that state. So we have a very, very large geography that we serve. The other thing about this is while Tarrant, Dallas, Collin, and Denton are really pretty urban, it gets very rural very quickly. And any of you who are familiar with this, you start getting into Jack County, Palo Pinto County, Erath County, not very far geographically from these large urban areas. It is very, very rural. So let's talk about rural communities in general first. Rural residents are typically older. They typically have less income and less assets, and they're typically less educated. They're also less healthy. You see a lot more smoking in rural residents, and unfortunately, you see a lot of smokeless tobacco products, especially in the younger generation and in the high schools, and dare I say, in the junior high schools as well. Obesity is a greater problem in the rural areas, and they're less likely to have regular checkups and preventive screenings. They are also less likely to have visited a health professional in the past year. Back to this map that I was showing you, as we were doing some of our research for some of our grants, we started doing some county profiles, and here you'll see Jack County, and again, not too far from Tarrant, which is a very urban area. And in Jack County, there are more veterinary facilities than there are medical facilities. It's very much a ranching community, and so this is the type of areas that we are talking about. Let's talk about now rural cancer survivors. About 1 in 5% of these cancer survivors live in rural settings. Rural cancer survivors are more likely to be diagnosed with advanced cancers and or die from cancer. And they're more likely to report these things such as fair or poor health, 2 or more non-cancer comorbidities, lower physical functioning, higher rates of psychological distress. So you at this point say, well, why would anybody want to live here? Why would anybody want to live in rural America? And again, having spent a lot of time there, the cost of housing is much less, and sometimes people just can't afford to live in some of the urban areas. Families are very strong, and a lot of these are farming and ranching communities, and so the greatest asset of the family is the land, and the land gets passed down from generation to generation, and people understand how to make a living off their land, either with livestock or with agriculture. A lot of it is this is just what people prefer. A lot of people prefer the solitude. But again, while they prefer this environment, this is the result: is that when they do get cancers, oftentimes they are not as healthy to begin with, and second of all, they struggle with having adequate access to the resources. A lot of the hospitals in rural America are struggling and are closing. And when the hospital closes, the physicians leave with them. And so now we're starting to get more and more of an environment in which they have a lack of either hospitalization or of physicians. And as the hospitals close, the ancillary services, including imaging and physical rehabilitation, go with them. The studies show that if you live in a rural environment, it takes you 6 to 10 times further distance to get to chemotherapy and 2 to 3 times of a further distance to get to radiation therapy. You might have seen this a couple of weeks ago. This was in the the MMWR Morbidity and Mortality Weekly Report from the CDC, talking about cancer in some of our rural areas. And again, the findings support what previous studies have shown, that there's a higher average annual age-adjusted death rate for all cancer sites. There's a higher incidence and death rate for cancers related to smoking, higher incidence and death rates for cancers that can be prevented by screening, specifically colorectal and cervical, and then the higher incidence of cancers related to HPV. So that's pretty much kind of where we are as a general state of the health of the cancer survivor in rural communities. Let me tell you a little bit about who we are and what we did. And I think that this will be important for some of you who were able to attend yesterday. We started our program 7 years ago on a very limited program. And so I think you might have heard yesterday, kind of start with what you have. We started with 2 rooms and a hallway. And that was it. And it was a psychosocial model, and that's all we had. And what was able to allow us to grow was some additional funding through the Medicaid waiver section 1115, and this is called a DSRIP project. Not all states have these. Fortunately, Texas was one of the states that did have this type of funding mechanism, and it was awarded to us in October of 2013. And at the time that we were awarded, we were expanded to, we took our current program, which was strictly at the Moncrief Cancer Institute in that very small environment that I was talking to you about, and we expanded that to 9 counties, not all of our counties, but to 9 of the counties, and I'll show you which ones they are in just a second. And this enabled us to add to the psychosocial model a medical model, and so we're now able to do things like late-term side effects and fertility preservation. You can see the models that were chosen. Actually, these were chosen by the state based on a very complex formula, but the service area that we serve for our survivorship program now, 55% of these counties are either fully or partially designated as underserved. And we've identified, or the statistics tell us, there are about 15,000 underserved cancer survivors in this region, and about 5,000 of those are at risk of non-adherence. And what this program in this targeted area was able to do for us was to look at this and say, how can we reach these very broad geographies in an efficient way? And so what we said is that we were going to build basically a mobile survivor clinic that would go out to these various regions and reach these underserved cancer survivors. And so we actually custom designed a clinic. Best we can tell, it's the first of its kind mobile cancer survivorship clinic. There are a lot of these that do dental work, a lot of these that do mobile MRI. This was specifically designed for a cancer survivor program. I heard some of you gasp, and I'm sure that's because you saw the price tag on this. It is not inexpensive, although the estimated life of something like this is anywhere between probably 10 and 15 years. And so while 1.1 million is a very large upfront cost, you can capitalize that over a relatively long period of time. And as I said before, we do target the underserved in the rural communities. On the unit, we have 3D mammography capability, telemedicine capability. We focus on our psychosocial model with the exercise and the nutrition, but we also have the ability to look at some of the medical issues. So we have consultation rooms. We can provide cervical cancer screening and phlebotomy services as well. I want to emphasize that the mobile clinic is really the last step in this journey. There are so many steps that happen before that with community partnerships, with outreach, with funding, with data and measurement, and with navigation. And so this is really how we started this. We just didn't drive this out there and say, come. We drove it out there, and we had lots of community engagement and participation. And so I'd like to let some of our community partners tell you a little bit about the impact that our mobile unit is going to have to their communities.
Very much. We're glad to have you here at the 8th edition of the Wise County Community Health Fair. And we're very glad to have the Moncrief Cancer Unit, the mobile unit here as part of this display today. It's a very important asset addition to our community.
As we all know, cancer is a tough battle, and even when cancer is in remission, that fight still isn't over. And it's important that cancer survivors have access to services so that they can continue beating cancer and being successful in that fight. And too often in rural Texas and rural America, those services are few and far between. But in Wise County, that's not the case. And a part of that is going to be this endeavor by the Moncrief Cancer Institute.
1, 2, 3.
What about flaxseed? My wife has me eating flaxseed. So
flaxseed are high in omega-3, so you can get that from fatty fish, walnuts, and lots of other things. So you don't have to have just the flaxseed.
I'm excited to have it here. Anything that helps our citizens in the community be able to take ownership of the treatment of their care is a great thing. And we at the hospital feel like it augments the services that we're able to provide. So it's a good thing.
Tell me about how your lymphedema is today.
Today, not too bad.
I think coming out of a year of cancer treatment, I had lost so much body weight and strength and endurance that obviously the exercise program would have got me back up to speed. On my own, it took me over a year to become normal again. The design is so workable. The wheelchair lift makes it accessible for everybody. The decor inside is very comforting and relaxing. The artwork they chose was wonderful. You know, the soothing colors, relaxing. Obviously, the education, the team on board is all professional people that are working at Moncrief already, and they're bringing their expertise out to the communities.
So in the first 24 months of our rural program, you can see we've had over 850 encounters. Most of those are exercise just because that tends to repeat itself, but it's also extremely popular, as you can hear from the survivor. A lot of visits with our nurse navigator, and I'll talk to you more about that in just a second. You can see the way that it breaks down. Most are English speaking, but a very significant portion are Spanish speaking, and about a third are Hispanic, a third are non-Hispanic white, 20% African American, and about another 10% of other races. Almost all of these are without adequate insurance. Granted, a third of them are on Medicare, but you can see the great majority here have neither Medicare, Medicaid, nor any sort of commercial insurance. And then again, you can kind of see the way that it breaks down. The preponderance of these are breast, with a scattering of the melanoma, colorectal, and other cancers. We feel good that we've been able to increase our baseline screening for those with both breast cancer as well as colorectal cancer and bring them into greater compliance. And we've also done pre and post quality of life scores, and we've gotten a statistically significant improvement in our quality of life measures with the patients that we have served. I'd like to talk a little bit about outreach and how you actually get the word out with this, because yes, if you bring it, they will come, but only after you have put together the appropriate outreach and partnerships. And so this is a way that I shamelessly use the media in order to help promote this, and because it's free advertising, and all of these rural counties watch these stations. So Cindy, I'll let you start this one if you don't mind.
North Texas is home to an estimated 15,000 cancer survivors who are uninsured or underserved.
Yeah, and a lot of times they don't have easy access to follow-up care, but UT Southwestern is changing that. It has a multi-million-dollar custom 18-wheeler that takes medical care on the road, covering 9 rural counties and over 7,000 square miles.
From the outside, it may seem like just a big 18-wheeler in a parking lot, but inside, it's a full medical clinic.
Everything that we can do in our brick-and-mortar facility in Fort Worth, we can do on this mobile clinic.
Today, parked in Arlington, this is where women without insurance can go for a 3D mammogram, or where any cancer survivor can get a full checkup.
We don't turn anybody away, and we don't ever send anyone a bill.
For questions that can't be answered on site, there's telemedicine. Staff can call a doctor or psychologist to assist right away. By 2022, the National Cancer Institute estimates survivors will account for 5% of the U.S. population. And for many of them, transportation is the biggest barrier.
So we're taking all the services out to them.
Your actual heart rate will appear here.
There are exercise, nutrition, and counseling programs for cancer survivors, all free, paid for by the government.
I had a mass, but I didn't know it.
Angela Johnson was diagnosed with stage 3 breast cancer and didn't have health insurance.
I didn't know what I was going to do.
After a lumpectomy, she's getting fit, eating well, and thriving.
I'm able to exercise more. I'm able to communicate more about what's going on with me.
The same programs that helped her lose 40 pounds and stay cancer-free.
So I want to set a good example for the women that are in my life.
Are the ones she wants to share with other North Texas women.
Now, this mobile unit has bilingual staff standing by to bridge any sort of language gap. Again, they'll see women ages 35 and up for mammograms and cervical screenings, and any cancer survivor, men or women, ages 18 and up for survivorship program help. So that includes all that nutrition and exercise stuff you saw there. They do accept walk-ins, and if you want to know when the mobile unit will be in your area, head to my Facebook page and click like. I'm going to post where it's going with all the dates and times for you.
So I've got just a couple of minutes left, and I want to talk to you about some of the challenges because, you know, this slide I titled, you know, if they build it, yes, they will come. And just to kind of give you an example of the type of people that we see here, this is a 43-year-old who actually came to us with a symptomatic breast mass, was uninsured, undocumented, diagnosed with infiltrating ductal cell breast carcinoma in July of 2016. And we were able to help facilitate both her surgery, her chemotherapy, and her radiation therapy. And it really took all of the nurse navigator, the social worker, the genetic counseling. It took getting gas cards to this patient to be able to get to the treatment, as well as other financial assistance programs. Another 33-year-old male living in Cleburne, Texas, is a day laborer living in his friend's garage, uninsured, making about $120 a week, and because he works in Texas, did not qualify for the Medicaid program. Received an on-the-job injury and was sent to the emergency room for back pain, and they found testicular masses, which were presumptive for testicular carcinoma. And then, of course, discharged from the ER with no follow-up. And so he came to us, we took him in, and again, using community partners that we've established, we were able to get him the curative surgery that he needed. So there are challenges with this, and especially as you go into these underserved communities, once you have the community partnerships, once you have the reputation of trust, once you have the reputation of being able to help people, wow, all of a sudden you get all of these patients, and that is very much a challenge for us. Navigation is the critical component here. It's important in all populations, but it's critically important to have a strong navigation program for the rural and underserved populations. We pair a nurse for the clinical issue with a social worker for the financial needs. I know you talked yesterday about the cultural appropriateness of this. We always meet the patients where we are, and our staff is just wonderful at doing that. And I think because of this, that is the reason that we had this loss to follow-up rate of less than 5%. Once we grab hold of somebody, we are very, very tenacious at holding on to them and taking them through the entire process. I just want to finally conclude here, because my time is out, with I think this is why we do this, and I think this is why a lot of you do this as well, and this is really why it's worth it. And this is what this patient from Corsicana in Navarro County had to say about the ability to get these types of services.
I'm not a quitter. I'm always going to put everything, all my effort to everything I do. I'm going to give it 100%, if not more, to just keep on going. I'm still here fighting, and I can thank God that I'm still alive. I do it for my husband, my mom, my dad, and I give it all for my 4-year-old. I'm in remission. I'm completely cancer-free right now.
Yay! So welcome aboard.
Thank
welcome
you.
To the team. Keep up the good job. You've got great things in store for you. This isn't the end.
No, it's
just the beginning of a brand new journey.
I've got many more years to live.
Yes. Awesome. Thank you so much.
You're welcome.
Thank you for listening.